So in this lesson, we're going to look at how to interpret arterial blood gas results using the Resuscitation Council UK 5-step approach. This is fast, it's simple, and it's perfect for your medical school exams or even the MRCP. Here we go. Alright, so step 1. Always start with a patient. Arterial blood gas values are meaningless without clinical context. So ask yourself, how is the patient? Are they in shock? Are they ventilated? What's their oxygen level? And so on. For example, if the patient is shocked, then they might have low blood pressure. They might be unconscious. We know they're not really well just by looking at them, so we need to consider this when we're interpreting their ABG results. Now moving on to step 2. Check oxygen. So on an ABG, the oxygen level is represented by the partial pressure of oxygen, or PAO2, which should be more than 10 kilopascals on air. If it's less than that, then your patient is Now, hypoxemia can be caused by many things, including high-altitude lung conditions like pulmonary fibrosis or pneumonia, or circulatory problems like pulmonary embolism. Moving on to step 3, look at pH. So a normal pH is between 7.35 and 7.45. If it's below 7.35, then it's too acidic, and this is called acidemia. If it's above 7.45, then it's too alkaline, and this is called alkalemia. Now both of these can be caused by a number of different problems, and we LLIs talk more about this later in the video. Moving on to step 4. Check carbon dioxide. Now the normal range for carbon dioxide is between 4.7 and 6 kilopascals. Moving on to step 5. Look at bicarbonate. Now bicarbonate is a chemical that acts as a buffer in the blood. It helps to keep the pH within the normal range. The normal range for bicarbonate is between 22 and 26 mol/L. If it's less than 22 mol/L, then it's too low, and this causes metabolic acidosis. If it's greater than 26 mol/L, then it's too high, and this causes metabolic alkalosis, so the kidneys control pH by controlling bicarbonate. If the kidneys are not working properly, then they won't be able to keep the pH within the normal range. Now let's summarize everything using the mnemonic ROME. This stands for respiratory opposite, metabolic equal. So take a look at this table. In the top left corner, we have the respiratory system. If there's a problem with the respiratory system, then the pH will change in the opposite way to the primary problem. So for example, if there's respiratory acidosis, then the pH will fall. The PAO2 will be high and the HCO3 will be high as well, but it's the pH that's the primary problem. In contrast, on the right-hand side, we have metabolic disorders. If there's a problem with the metabolic system, then the pH will change in the same way as the primary problem. So for example, if there's metabolic acidosis, then the pH will fall and the HCO3 will be low. But remember, the pH is the primary problem here. The PAO2 might be high or low, but it doesn't really matter. Next up, let's look at the acid-base table. This summarizes all of the acid-base disorders. It shows the pH, the primary problem, as well as any compensation that might occur. So for example, in diabetic ketoacidosis, DKA, the pH will fall because there's an accumulation of ketones and other acidic compounds. This is metabolic acidosis. The kidneys will try and compensate by increasing the breathing rate. This will get rid of carbon dioxide and increase the pH slightly, but it's still lower than normal. Next up, let's run through some compensation rules. These are useful to know for the MRCP if the patient has metabolic acidosis. Then use Winter's formula to calculate what the HCO3 should be. It's quite an easy calculation. Just multiply 1.5 by the HCO3 and add 8. If the result is between 2 and 12, then it's normal. If it's less than 2, then it's low. And if it's more than 12, then it's high. With respiratory disorders, finally, some MRCP quick tips. In metabolic acidosis, always check the anion gap. Make sure to use the compensation rules and consider mixed disorders. If the pH is normal, but the gases are abnormal, then always consider a mixed acid-base disorder. If the patient has respiratory acidosis, then it's usually fast. If they have metabolic acidosis, then it's usually slow. In summary, the 5 steps to a BG success are patient, oxygen, pH, respiratory, metabolic. If you master this flow, then a BG interpretation becomes easy. And just before I leave, a huge shout out to my supporters. Thank you so much for supporting me. I hope you guys enjoyed this video. If you did, don't forget to subscribe and I'll see you in the next video.